Question 1. A physician orders 500 milligrams of a medication. The vial is labeled 250 milligrams per 5 milliliters. How many ml should the nurse administer? A. 5 milliliters. B. 10 milliliters. C. 15 milliliters. D. 20 milliliters. Answer: B. 10 milliliters. Question 2. A client is to receive 1 liter of 4 fluid over 8 hours. The 4 set delivers 20 GDT/ml. What is the correct drip rate? A. 20 GDT/min B, 25 GDT/min C, 42 GDT/min D, 50 GDT/min. Answer: C. 42 GDT/min. Question 3. A child weighing 20 kilograms is prescribed 5 milligrams per kilogram per day of a medication in 2 divided doses. How much should each dose be? A. 25 milligrams. B. 50 milligrams. C. 75 milligrams. D. 100 milligrams. Answer: A. 25 milligrams. Question 4. The order is for heparin 5,000 units subcutaneously every 8 hours. The vial is labeled 10,000 units/ml. How many ml should the nurse administer per dose? A. 0.2 milliliters. B. 0.3 milliliters. C. 0.4 milliliters. D. 0.5 milliliters. Answer: A. 0.5 milliliters. Question 5. A nurse is preparing to administer 0.3 milligrams of a drug. The available tablet strength is 0.1 milligrams. How many tablets should the nurse give? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer: C. 3 tablets. Question 6. A patient receives a continuous 4 infusion of dopamine at 5 micrograms per kilogram per minute. The patient weighs 70 kilograms. What is the total dosage per minute? A. 250 micrograms per minute. B. 350 micrograms per minute. C. 400 micrograms per minute. D. 500 micrograms per minute. Answer: B. 350 micrograms per minute. Question 7. An order reads 1 g of cefazolin. The vial is labeled 500 milligrams per 2 milliliters. How many ml will the nurse administer? A. 2 milliliters. B. 4 milliliters. C. 6 milliliters. D. 8 milliliters. Answer: B. 4 milliliters. Question 8. The provider orders furosemide 80 milligrams for. The available concentration is 10 milligrams per milliliter. How many ml will the nurse administer? A. 6 milliliters. B. 7 milliliters. C. 8 milliliters. D. 10 milliliters. Answer: C. 8 milliliters. Question 9. A client is to receive 75 milliliters per hour of 4 fluids for 12 hours. What is the total volume to be infused? A. 600 milliliters. B. 750 milliliters. C. 900 milliliters. D. 1,200 milliliters. Answer: C. 900 milliliters. Question 10. Which of the following tasks is appropriate to delegate to a licensed practical nurse, LPN? A. Assessing a client with new onset chest pain. B. Administering 4-push morphine. C. Reinforcing teaching on insulin administration. D. Creating a care plan for a diabetic client. Answer: C. Reinforcing teaching on insulin administration. Question 11. A medication is ordered at 2 milligrams per kilogram. The child weighs 18 kilograms. How many mg should be administered? A. 32 milligrams. B. 36 milligrams. C. 40 milligrams. D. 44 milligrams. Answer: B. 36 milligrams. Question 12. A provider orders 60 milligrams of a medication. The label reads 20 milligrams per 5 milliliters. How many ml should be administered? A. 10 milliliters. B. 12.5 milliliters. C. 15 milliliters. D. 20 milliliters. Answer: C. 15 milliliters. Question 13. Which task is most appropriate to delegate to a certified nursing assistant, CNA? A. Ambulating a stable postoperative client. B. Administering oral medications. C. Performing sterile wound dressing changes. D. Monitoring a chest tube. Answer. A. Ambulating a stable postoperative client. Question 14. A physician prescribes a medication 75 centimos. The pharmacy sends 250 milligrams tablets. How many tablets will the nurse administer? A. 2 tablets. B. 3 tablets. C. 4 tablets. D. 5 tablets. Answer. B. 3 tablets. Question 15. A client is receiving a dopamine drip at 10 micrograms per kilogram per minute. The client weighs 60 kilograms. What is the dose per minute? A. 400 micrograms per minute. B. 500 micrograms per minute. C. 600 micrograms per minute. D. 700 micrograms per minute. Answer. C. 600 micrograms per minute. Question 16. A nurse receives the following orders. Which should be prioritized first? A. Administer PRN acetaminophen. B. Check blood glucose in a diabetic client. C. Reassess a client with decreased urine output. D. Teach a new diagnosis to a patient. Answer. C. Reassess a client with decreased urine output. Question 17. A nurse calculates 75 milliliters per hour for a medication that must run over 6 hours. What is the total volume to be infused? A. 300 milliliters. B. 375 milliliters. C. 450 milliliters. D. 500 milliliters. Answer. C. 450 milliliters. Question 18. A client is prescribed 250 milligrams of a drug. The available dose is 125 milligrams per 2 milliliters. How many ml should be administered? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. Answer. C. 4 milliliters. Question 19. Which of the following clients should the nurse assess first? A. A client with stable vital signs post-op day 2. B. A client complaining of chest pain with nausea. C. A client requesting pain meds. D. A client preparing for discharge. Answer. B. A client complaining of chest pain with nausea. Question 20. The order is for 0.5 milligrams for. The vial contains 1 milligram per 2 milliliters. How many ml will you give? A. 0.5 milliliters. B. 1 milliliter. C. 1.5 milliliters. D. 2 milliliters. Answer. B. 1 milliliter. Question 21. A provider orders 750 milliliters of 4 fluid to infuse over 6 hours. What is the infusion rate in ml/HR? A. 100 milliliters per hour. B. 115 milliliters per hour. C. 125 milliliters per hour. D. 150 milliliters per hour. Answer. A. 100 milliliters per hour. Question 22. A medication order is 1.2 g. The available vial is 600 milligrams per 2 milliliters. How many ml are needed? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. Answer. C. 4 milliliters. Question 23. A nurse receives orders for 4 clients. Which client should the nurse see first? A. Client with blood glucose of 70 milligrams per deciliter. B. Client complaining of mild dizziness. C. Client with a potassium level of 2.9 milliequivalent/L. D. Client due for wound care. Answer. C. Client with a potassium level of 2.9 milliequivalent/L. Question 24. A client is to receive 1,200 milliliters of 4 fluid in 8 hours using a 15 GDT/ml set. What is the drip rate? A. 30 GDT/min B. 35 GDT/min C. 38 GDT/min D. 40 GDT/min. Answer. D. 40 GDT/min. Question 25. An order reads 0.4 milligrams. Available. 0.2 milligrams tablets. How many tablets should be given? A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. Answer. B. 2 tablets. Question 26. Which task is most appropriate to delegate to a newly certified CNA? A. Measure intake and output. B. Administer an enema. C. Apply a sterile dressing. D. Suction a tracheostomy. Answer: A. Measure intake and output. Question 27. A patient needs 200 milligrams of a drug. The pharmacy provides 500 milligrams per 10 milliliters. How many ml will you give? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. Answer: A. 4 milliliters. Question 28. A nurse is preparing to administer 0.6 g of a medication. The label reads 300 milligrams per 2 milliliters. How many ml should be given? A. 2 milliliters. B. 3 milliliters. C. 4 milliliters. D. 5 milliliters. Answer: C. 4 milliliters. Question 29. Which client is appropriate to assign to an LPN? A. Client requiring 4 morphine. B. Client with newly diagnosed hypertension. C. Client with stable pneumonia requiring oral antibiotics. D. Client with a new chest tube. Answer: C. Client with stable pneumonia requiring oral antibiotics. Question 30. A medication is ordered 15 milligrams per kilogram per day in 3 divided doses. The patient weighs 60 kilograms. What is each dose? A. 200 milligrams. B. 250 milligrams. C. 300 milligrams. D. 350 milligrams. Answer: B. 300 milligrams. Question 31. A client needs 400 milliliters of fluid over 4 hours. What is the ml/HR rate? A. 50 milliliters per hour. B. 75 milliliters per hour. C. 100 milliliters per hour. D. 120 milliliters per hour. Answer: C. 100 milliliters per hour. Question 32. A provider prescribes 0.25 milligrams. The available ampoule is labeled 0.5 milligrams per milliliter. How many ml should the nurse draw up? A. 0.25 milliliters. B. 0.5 milliliters. C. 0.75 milliliters. D. 1 milliliter. Answer: A. 0.5 milliliters. Question 33. Which situation reflects safe delegation? A. RN assigning a UAP to assess skin turgor. B. LPN assigning a UAP to monitor pain level. C. RN assigning an LPN to perform catheterization. D. RN delegating medication teaching to a UAP. Answer: C. RN assigning an LPN to perform catheterization. Question 34. A medication is ordered at 0.3 milligrams per kilogram for a 90 kilograms patient. How many mg should be given? A. 27 milligrams. B. 30 milligrams. C. 33 milligrams. D. 36 milligrams. Answer: A. 27 milligrams. Question 35. A client is ordered 2,000 milliliters of 4 fluid over 24 hours. What is the ml/HR rate? A. 80 milliliters per hour. B. 83 milliliters per hour. C. 85 milliliters per hour. D. 90 milliliters per hour. Answer: B. 83 milliliters per hour. Question 36. An order is written for 75 milligrams of a drug. The nurse has 25 milligrams tablets. How many tablets are needed? A. 2 tablets. B. 3 tablets. C. 4 tablets. D. 5 tablets. Answer: B. 3 tablets. Question 37. A nurse is delegating to a CNA. Which instruction is most appropriate? A. Monitor the client's blood pressure post-medication. B. Assist the client with ambulating after breakfast. C. Change the sterile dressing on the client's leg. D. Educate the client on the side effects of the new medication. Answer: B. Assist the client with ambulating after breakfast. Question 38. A provider orders 2 milligrams per kilogram of a drug. The client weighs 45 kilograms. How many mg should the nurse administer? A. 80 milligrams. B. 85 milligrams. C. 90 milligrams. D. 95 milligrams. Answer: C. 90 milligrams. Question 39. A nurse prepares to give 0.75 milliliters of a medication labeled 2 milligrams per milliliter. How many mg are in the dose? A. 1 milligram. B. 1.25 milligrams. C. 1.5 milligrams. D. 2.0 milligrams. Answer. C. 1.5 milligrams. Question 40. Which of the following clients should the nurse assess first? A. A post-op client reporting moderate pain. B. A diabetic client with blood sugar of 210 milligrams per deciliter. C. A client with a pulse of 44 BPM. D. A client due for a routine dressing change. Answer. C. A client with a pulse of 44 BPM. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.